What can you do for this? Well, let's talk about it. Non-surgical, surgical, okay? Can you treat it with rehab? If it's a significant tear that it's disrupted, and we don't have any photos of the injury or imaging or anything like that, so we don't know all the details. But if it's a significant disruptor, and you can actually do a primary repair, and then you just put it back, and then you're talking about the 6 to 8, the 3 to 6 to 9 months of healing, depending on the phase of rehabilitation, biology of healing. Like, say, for example, there's something else going on. Maybe he has a medical disorder we don't know about that caused his tendons to be weak. And then that needs treatment, because if you don't treat the underlying metabolic medical cause, then it's not going to heal as well. Now, I'm not saying he's a smoker, but smokers are the ones that are prone to delayed healing and problems. And that's why oftentimes, if you've been a patient of mine and you are a smoker, you know that I recommend to stop smoking for a minimum period of time prior to the surgery and for at least the healing time afterwards. And it's a good way to stop, 17 times worse healing due to the nicotine reducing the oxygen blood supply inside your muscle, bone, tendon healing structure. Imagine that. 17x. That's 1700%. Now, I'm quoting some papers, and I'm sure there's studies that have variations above and below that, but that's the one that sticks with patients. When they hear that, they're like, doc, I know, I gotta stop. Some patients don't care, and hey, doing surgery on a patient that doesn't work together with you, where they say, I'll take care of my diabetes or my infected toenail or my smoking habits and whatever before the surgery because I want to have the best outcome. If you're going to have surgery, you're going to get cut under the knife, under anesthesia. You want to be at your best possible health, especially if it's a elective, non-urgent emergent surgery. Now, in this case, with a tendon disrupture, you want to get at it within a couple of weeks at the latest for a major tendon like that, or sooner. And so it may not be as elective as it were, but it is important to know all the risk and benefit of surgery before you go in.